Hello, welcome to today's topic on the symptoms of coronavirus, which will give us an idea of how do I know if I've got the virus without being tested. Now, I've been working on the front lines for the last 6 weeks dealing with COVID patients, ranging from the very mild, those patients who have just mild symptoms of maybe fever or headaches, which can last 5 to 7 days, to the very severely ill. We're talking patients who practically need oxygen to even make it to the hospital. Now, as we all know, the virus is called Covid19, which is a particular strain of the coronavirus, which was initially thought to affect animals, but now this strain has found to be in humans as well. Now, this virus was traced back to Wuhan in China in January 2020, but depending on what source you read, this virus might have been circulating as far back as November 2019. Now, the incubation period of the virus is thought to last from between 2 to 14 days. So basically, if you've been in contact with someone who's had a virus, now you're expected to self-isolate for up to 14 days, after which, if you've not had any symptoms, you're now assumed to be non-infectious. However, we all know that this is not the case. Now, for instance, there are two scenarios here. First, we've got the asymptomatic carriers. Now, these are the people who are carriers of the virus but who bear no symptoms. So you could be sitting with someone who's got no symptoms, and all of a sudden, 2 days later, you start getting the fever and chills, and you're wondering, how did that happen? I've not been in contact with anyone who's been coughing or had any fever. Basically, there are people who have the virus and they do not know they've got the virus. And another group is the children. Children are known to be carriers of the virus and they necessarily do not have any symptoms. Now, the second scenario is that the virus is thought to last for about 2 weeks. Now, we've now seen that the virus can actually last for longer than 2 weeks, despite the government's advice of stay at home for 2 weeks. I personally know patients who've at least gone 7 weeks and still tested positive for coronavirus, because basically swab tests, when swabs are done, they're being done inside the nose. So there's now a postulation that, this virus could be already dead. And that's the reason why the test is still positive. Now, like I said, that's just a theory. Now, in terms of people who've got no symptoms, this is why it's very important that we should do testing. Now, testing is what's going to tell us, am I positive for the virus or am I negative for the virus? However, it has come too late because guess what? 30,000 plus people have lost their lives to the virus. And the testing has only just started like 2 weeks ago. Okay, so basically, I'm not going to get too much into, the controversy about this virus. Rant over. So now let's talk about the symptoms. So basically fever. Now fever, as we all know, can present with feeling hot and cold, chilly, night sweats, having temperatures of above 37. Another symptom is headaches. That pounding sensation that you get in your head that never seems to go away. Now sore throat. When I ask people with COVID-19, what does it feel like? They tell me it feels like a burning sensation or like they're swallowing blades. And when you look into the throat of these people, there is no white spots, there is no swelling of the tonsils that would normally indicate that they've got bacterial tonsillitis. Cough. Most people would describe a dry cough, which can be continuous. And usually there is no mucus produced with the cough. But in some cases, you might produce a small amount of yellow or green mucus. Now, this can be indicative of a bacterial infection such as pneumonia, especially if you're going into the second week. Now, other symptoms people can experience, muscle aches. You just feel your muscles are aching, your chest, your arms, your legs, any movement of the body can be quite painful. Extreme tiredness. You just feel so fatigued that you just want to lie in bed all day. You find it difficult to get out of bed in the mornings. Simple activities like having a bath, cooking, taking the dog for a walk becomes impossible. Now, loss of sense of smell and taste. This is a peculiar symptom and this is one of the clues as to if you've got the virus. Now, in a lot of people, when you've got the flu or when you've got nasal congestion or blockage of the sinuses, you might experience a loss of sense of smell and taste. But in this case, you do not have any of those symptoms and all of a sudden you just cannot smell. You just cannot taste the foods that you normally will be able to taste. Now, this is one of the clues that you might possibly have the virus. Now, one of the most important symptoms to look out for is chest pain. Now, when a patient tells me they've got chest pain, I'm on alert because I'm thinking, could this be heart related? Could this be a heart attack? Could this be a pneumonia? Could this be a blood clot in the lungs that can present as chest pain? Could this be anxiety? Or could this be due to muscle aches that can cause chest pain? This is normally a sign that you need to be seen. So if you've got chest pain, do not hesitate to see a doctor straight away. One of the most important symptoms is shortness of breath. This is normally an indication that there is not enough oxygen going into the lungs. So basically, if you've got shortness of breath and you also have underlying conditions such as asthma or chronic lung problems, you need to see a doctor straight away. Now, apart from these respiratory symptoms that we've talked about, we also have non-respiratory symptoms like abdominal pains. diarrhea, vomiting. Now, one new symptom that I've recently encountered are what we call Covid toes. And these are basically symptoms where you experience shiny lumps on the tips of your toes. Now, this is more common during winter where there is a condition called chilblains. Now, if you're experiencing that condition in the warm weather, you have to suspect this is not chilblains. This is what we call Covid toes. Now, these symptoms normally go away within 2 to 3 weeks. Now, you can see that from all the symptoms I've mentioned, these are not specific to the coronavirus. So the question is, how do I know I've got the coronavirus? The real answer is you don't know that. You don't know that until you've been tested. What you have to do is you have to suspect that this might be coronavirus, especially if the symptoms are leading into the 2nd or the 3rd week and you're still not getting any better. Because in terms of flu normally on average would last about 10 days and you should start to feel better after 10 days. So if you're on day 10 of your symptoms and you're not getting any better, you should be seeing a doctor. Look, there might be 2 or 3 symptoms that I might have missed out, but this is a new virus that we're still getting to know, that we're still getting to learn about, and every day I'm learning something new about this virus. These symptoms can appear in other conditions such as pneumonia, blood clots in the lungs, pulmonary fibrosis, tuberculosis, bronchitis, you name it. There's so many symptoms that overlap with the coronavirus, so sometimes it is impossible to differentiate, which is why it's very important that you need to see a doctor. Now, if you like this video, please press the button and subscribe to my channel. Now, in the next video, I'm going to be teaching you how to check yourself using the necessary equipment to see if you might have the coronavirus. So let's recap the symptoms to look out for. Fever, headaches, sore throat, dizziness, loss of sense of smell, chest pain, cough, muscle aches, fatigue, bowel changes, painful toes. If you have any of the symptoms and they're not getting better into the 2nd week, you need to see a doctor, and also you need to self-isolate yourself from relatives, from people who are high risk, people with low immune system. Also, check out my videos on how to protect yourself against the coronavirus.